Today's message is all about one thing. One thing. Okay, America. Hope. And this is very real. What I'm going to tell you is going to make you smile. It's going to make you feel a little better. So share this video to all your very concerned friends and family. I want you to understand what I'm hearing about there is, oh my gosh, look what's happening in Italy. The death toll's gotten worse than China. I understand, very serious. This is true. And oh my gosh, everybody's going to get it. I think Chancellor Merkel came out and she said, oh, it's going to be 70% of all of Germany gets affected. That actually may be true. So we can't do anything here in America. It's not going to happen. Everyone's just going to get it anyway. So we might as well just succumb to this. Not true at all. We knew ahead of time. We were stopping people ahead of time. I'm very proud of our government. Both sides, Democrat, Republican, are working together. How long has it been, y'all? How long has it been since they've been working together? Everyone's working together, putting their differences aside. They're passing all sorts of things every day. I'm really proud of all of our branches of government. They're doing a great job. So, number one, understand this. If you slow down the infection, there's 3 phases to this. Number 1, number 2, and number 3. If you will slow down the rates of infection, particularly the rates for the people that are most at risk, you'll hear me say this all the time, age over 60, definitely 70, 80, and immunocompromised. Anyone particularly on steroids for any conditions. You will not overwhelm the system. Remember how many times we talked about the chart? If this is the hospital capacity, if we all of a sudden have too many people sick at one time, these people are at risk. So we want to slow down the transmission like this. So we always have enough hospital beds, always enough personnel, everything we need. So that's number 1. It is working. We're slowing it down. Number 2, every day this goes by, we're finding out new novel therapies that are both stopping or at least slowing the progression of COVID in our own bodies, that is, and further what medicines not to use. We're only like, for instance, ibuprofen. Great for bringing down a fever. However, it may be stopping some of our capacity of our immune system to do the things it needs to do, actually helping the coronavirus take hold a little bit more. We're learning all these things, and there's been some big news on one certain medicine that may be working very well. So the further out we can prevent getting this, the more of our therapeutics. So better medicine. Hold out. Keep doing a good job. Better medicine. Okay? So have good doctor handwriting, right? Just like always. Number 3, and this is the big one, vaccine. If everything goes well, they're already testing lots of vaccines. Again, we should be a year to year and a half, and I know they're saying a best case scenario, but I think we're going to do it. And you see the worst has happened. And remember, there's 2 types of vaccinations. The one that we make in the lab, and remember, when this comes back around, it's seasonal, there's going to be many people that are auto-vaccinated. What does that mean? They already got exposed, they already got over it, and they've already got the antibodies. So now they're walking around and they're not going to be spreading the virus. Okay? So holding out, washing your hands, surfaces you touch, trying never to touch your face until you can at least wash your hands again. All the precautions you're taking, we can get through this and slow it down, and importantly get our economy recovered. Like for instance here, we're doing everything we can to balance absolute incredible safety. Watch some of our other videos to see what we're doing of our patients while continuing to maintain a reasonable level of business, to continue to support our employees and try not to lay anyone off at the bleeding edge unless the government just completely shuts us down, and be socially responsible with medical supplies and everything that we're using. So stay tuned. We're doing absolutely incredible deals on surgery in the future. Okay, we're reminding everybody we're actually selling cosmetic surgery at cost for people that purchase it 3 months in the future, where none of the doctors are making any profit. We're doing that to help our patients. And further, stay tuned. We've been doing things with a lot of our injectables that don't take medical supplies, and so we continue business as normal. We're trying to help our economy, at least here locally as well. So, hope is the message. Slowing down is working. Proud of our government. We're going to recover from this medically. We're going to recover from this financially. Spread the word. It's going to be okay.